First time I've really talked today. Welcome members to and the public to the Aging and Long-Term Care Committee. This morning we have the Minnesota Department of Health to give us their latest update on the vaccine rollout. And then after that, that'll be about an hour. And then after that, we are going to have, Senator Carla Nelson with her Senate File 178. On her Alzheimer's public information program establishment. So I'm looking forward to that too. We're going to jump right into MDH. We've all heard on the news. It was even again last night on all four channels. Just the concerns of the vaccine rollout, and again, this committee has expressed our concerns that we believe that seniors, especially those over the age of 65, should be getting the vaccines first and bring the vaccine to them instead of them having to go across state to try and find the vaccine. They've been anxious and locked up for 11 months, and now when the vaccine, they want to be able to get it easily and conveniently. So I'm going to have them present. We've got Chris Erzman, Infection Disease Director from the Minnesota Department of Health, and then she has with her Margaret Kelly, the Deputy Commissioner from the Department of Health. I'm going to have them do their presentation, and members, we can jump in as long as we know that by 9:30 we have to be done and out of this presentation, because we got to allow for enough time for Senator Nelson. So we will shoot it right on over to you, Ms. Erzman, and thank you so much for coming.
Yep. Thank you, Chair Housley. I just want to check that you can hear me.
Yes, we can hear you. Thank you.
Yep. Okay. So next slide, Lisa. So I just wanted to start by giving you an update of what we are seeing in terms of our COVID cases in long-term care settings, just to kind of frame some hopefully positive news. You can see here, that we had the increase in the spring, and then the battle plan was introduced, and we really saw cases under control for quite a while until we reached that point in the state where our community transmission was so broad that it kind of didn't matter where or what you were doing. It was pretty much overwhelming everyone. And you can see here, we've got cases broken out by residents, by staff, and then by total cases. And I'll just point out again that initially we were seeing more cases in the residents, but as we, moved into more activity, more social activity and more transmission in the community, we started to see that staff cases were increasing as well. But the good news is that the numbers are coming down appreciably. And I'm just going to, Lisa, if you could do the next slide. I just want to point out here, this is looking by facility type, so by skilled nursing facility and by assisted living. And I want to acknowledge that we have seen over the course of the pandemic that skilled nursing facilities have seen more cases than assisted living pretty much all of the time. And this last week, we are seeing that the case numbers are more even, and we think this may have to do with the fact that our skilled nursing facilities have had the opportunity to receive first doses. I mentioned on the media call yesterday that, I'm always saying that a single day or week does not make a trend. And so even though this is good news, I'll say that we don't want to jump to conclusions until we have more data, but I find it very encouraging that we're starting to see improvement in these populations, and I think our vaccination efforts have and will make a great deal of difference. Next slide. So just to kind of reiterate, our vaccination efforts in phase 1A balance the goals of preventing morbidity and mortality with preserving societal function. So we were vaccinating those individuals living in long-term care settings because of their heightened risk and vulnerability, as well as preservation of societal function, making sure we had the healthcare workers necessary to care for them. And so just want to acknowledge that those are the goals that we continually balance. Next slide. So just to let you know where we're at, we have completed the first phase 1A first priority group. So all residents in skilled nursing facilities and staff have had the opportunity to receive a first dose of vaccine based on a survey that we did with facilities. And so it's voluntary for them to respond. But what we saw was that 81% of residents had chosen to be vaccinated and 48% of staff. And then we have had some preliminary information. A few facilities are already receiving their second doses, and you can see what they've reported to us. Now, I want to acknowledge a couple things. One is that when we talk to CDC, what they have been hearing is that when the vendors go back to do the second doses, there are a number of people who then, about 20% of people who will then choose to be vaccinated with a first dose on that second visit, and then they do go back a third time. So we did plan for that, but just want to acknowledge that we are hearing that people are accepting doses kind of after that first round. Next slide. Then for our second phase, we've finished with healthcare personnel in that group. And then for our assisted living, all of our vendors have said that they're expecting to complete this by the week of February 8th. And so these appointments are already scheduled. The facilities are all ready to go. They're just in the process of working their way through them. So that is also very encouraging news. Next slide. We are continuing to finish the third priority group for healthcare providers who had not been vaccinated in those first groups, as well as the long-term care residents who are residing in group homes and other facilities for individuals with intellectual, physical disabilities and elders living in these group settings. And so that continues. Next slide. So just to reiterate, all the skilled nursing facilities have received their first dose. Of the assisted living facilities, almost 1,200 have received their first dose. And as I said, they should be completing that next week. Second doses are being scheduled, and third clinics are being offered again to allow individuals who were a little concerned about being the first to get vaccinated. They have additional opportunities. And the 20%, as I mentioned, that people are showing interest in being vaccinated on that second go around. Next slide. So again, as we're looking at the addition of additional individuals to be vaccinated, we're again balancing those goals of preventing morbidity, mortality, and preserving societal function. And we're obviously focusing on individuals 65 years of age or older. Next slide. So just to give you an idea of what is happening in terms of the numbers, our weekly federal allocation has been about 68,000 doses, and we've heard of some increases in the coming weeks. So we've added a number of doses, so that will go up. But in general, they have said that they are for 3 weeks at a time, and so just roughly saying that our allocation, even if it's at 75,000, it's still much less than we need. And when we added 65 plus and childcare and educators, we added 1.1 million people for vaccination. Additionally, that was added before we had finished phase 1A. And so at our current rate of allocation, we think it'll take us about 16 weeks or 5 months to finish this group. Next slide. And I think, Margaret, were you going to take over from here?
I am, Chris. Thank you.
Okay.
Members of the committee, my name is Margaret Kelly, Deputy Commissioner at the Department of Health, helping to stand up our state vaccination effort. So what you're seeing here is a current snapshot of the dashboard that is on, I'm sorry, I don't know the exact address for the website, but you can get to it from the MDH website. And what this shows is some of the high-level information we are trying to track about our success rate with vaccinating Minnesotans. I think on the blue bar at the bottom, let me start with yep, I'll go to the blue bar on the bottom. The governor, and we'll talk about this again in a minute, has set a goal that 90% of vaccines will be administered within 3 days of being received by the provider and reported to MDH within 24 hours, and that 100% of vaccines will be administered within 7 days of being received. So you'll see we're at about 77% for meeting that 3-day goal. It was 75% just a few days ago, so we are continuing to improve there. And we're at 91% for our 7-day goal, and we were at 90% just a few days ago as well. And in the right corner is the number of people with at least one dose per capita rate here per 100,000 population. So we're at 8,000 per 100,000, which is about 8% of our population having had at least one dose. And so this would also include people who have had a second dose as well. The teal colored bars kind of in the center there, you can see a week to week change in the number of vaccines that we've administered. You see the little buttons on the left there that say weekly and daily. This is an interactive web page, so you can toggle between those two to see how many have been administered by week or by day. In the map on the left, you can hover over that to see information by county. There are also tabs along the top where you see the summary is highlighted in light blue. You can click on all of those to see greater detail as we develop this dashboard out. Next slide, please. So this is on the Who's Getting Vaccinated tab. You can see the 8.1% there, the population of people in Minnesota who have had at least one vaccine dose. 2.1% of our population has completed the vaccine series, having both the first and the second dose. And we've highlighted here the number of people or the percent of Minnesotans in the age 50 to 64 category and 65 plus category who have had at least one vaccine dose. And you can look at this from day to day to see how that changes, to see how we're improving the rate at which people over the age of 65 are getting vaccinated. And again, there's a map here with this detail at each county level that you can hover over to see the detail for. Next slide. This graph here shows you from day to day how many newly reported vaccine doses we are receiving in our system. And the bars show the number by day, and the green line shows a 7-day rolling average that kind of smooths out the ups and downs. And you can see that there clearly is a pattern. So we have highlighted in a lighter blue Mondays. So you can see kind of the 7-day pattern here. We order vaccines, and Chris, please correct me if I'm wrong, but we place orders for vaccines on beginning Thursday night and into Friday. And then those vaccines are shipped out from federal warehouses to our providers, and they start arriving Monday and Tuesday. And then typically they are being in arms Wednesday through following Monday. So you can see the pattern Monday.
Margaret?
Yep, go ahead.
Yep, no, that's accurate, but I just want to say that they don't always arrive Monday and Tuesday. I just want to acknowledge that every provider in the United States is wanting to get their vaccine, and it's coming at the same time. So some doses do come Monday and Tuesday, but it can take longer than that for them to arrive. So just want to acknowledge that there's no guarantee they come the first 2 days of the week.
Thank you. But you can see that typically the most number of days that vaccines are administered and reported is later in the week. And next slide. Can you go back one slide? I forgot to make a comment, but I think also what this graph shows you is the pace at which we are increasing the doses administered. And it's both an increase in the number of doses that the state's receiving, but it's also an acceleration on the part of our providers to use up doses that they have so that we're getting doses in arms more quickly. Next slide. So some of the announcements that from last week, we did announce our goals for both 90% of doses administered within 72 hours and 100% within 7 weeks, a strategy to ensure that we are getting people vaccinated as quickly as possible. We also improved our registration process for the 65 plus appointments at our pilot sites. So we will be, I think you recall the very first time we opened up registration, it was opened at 5 a.m. and people tried to call and make the appointment at that point in time. And there were long waits on the phone and in waiting rooms. And those who were able to successfully navigate that system got appointments, and it felt akin to trying to buy rock concert tickets back in the 70s, I think, for many people. And so we have pivoted. We learned a lot from that, and we have pivoted. This past week, we opened up a wait list, so people for a period of 24 hours could log on and get their name on the wait list. Then we randomly selected people from that wait list, and we emailed them or contacted them however they asked us to reach them, by phone or by cell phone or landline or email, and offered them the opportunity to register. And so it was a much more measured approach and didn't feel as frenzied for people. We also expanded our goals for our dashboard online. We put those up for people to see. And we stood up a larger scale community site for people age 65 plus in St. Paul as well, in the Roy Wilkins Auditorium. Next slide. So announced this week, just past Monday, that we, in our allocations that we have made for vaccines this week, about 35,000 or more doses are going to providers throughout the state to vaccinate 65 plus. And these are doses that, the amount of doses specifically targeted based on how what our providers said they could do for that age group. But I will say there will be more doses than this for the age 65 plus group, in that our guidance has been currently eligible to receive vaccine are those folks within 1A category, plus people age 65 or older, and educators, including childcare workers. And we have given them the flexibility to use their doses for anyone in those eligibility groups. And so I fully expect more than 35,000 doses being used for people over the age of 65. We have new pilot clinics in Minneapolis and Duluth being stood up this week for the age 65 and over. And in addition, healthcare providers are able to vaccinate people in that age group as well. So people age 65 and over can choose how they would like to get their vaccine, if they would like to go to a state clinic, a state-sponsored clinic, or if they would like to reach out to their healthcare provider directly. And in order to help them with that, we have stood up a map on our website that tries to help people understand who has doses that they could reach out to, or who is providing vaccine clinics. It's our first week. We expect this map to improve every week as vaccines are rolled out and to have more information. Much of the vaccine is is being provided by invitation by our healthcare partners, reaching out to members who meet the age criteria, and they're offering vaccine appointments to them. And so the purpose of the map is to let them know who has vaccine for that age category. And we're going to continue to provide added detail in the coming days and weeks as we pull that data together on providers and how quickly they're using vaccine. We're also continuing to provide access to vaccines through to education and childcare professionals too, specifically for them, with some strategies to ensure that we have opportunities for them to get vaccinated. We had some regional sites, pilot regional sites 2 weeks ago. We will continue those with the second doses, and we are leveraging local public health and some of the state clinics as well for educators. Next slide. And I just want to speak on recent federal action announced last week and then again yesterday. Last week, they provided a 16% increase for a period of 3 weeks in vaccine allocations to states. And we're in week 2 of that. So last week was a 16% bump in our allocation this week as well, and for next week as well. We don't know if that will be a permanent increase in our allocation or if that's just a one-time 3-week bump. Yesterday, they also announced an additional 5% increase on top of that for 3 weeks as well. And so this will be week 1 of that 3 weeks. So for this week, it's 21%. If I'm doing my timing correctly, next week will be 21% as well. And then we don't know what will happen after that. They are announcing it in 3-week increments. And they're also, the federal government is working with manufacturers to ramp up production. And really, what we need is more vaccine. And we're relying on the federal government to address that. The federal government also announced a federal retail pharmacy program, the first phase of this program. Minnesota will be allocated 16,900 doses through a formula-based allocation for this program. Selected pharmacies were based on their ability to reach the most at-risk populations, and they will vaccinate priority groups at no cost. And Chris, I'm going to ask you to, if you could speak to who the pharmacies are, if we know that yet in this.
Yes, thank you. And just to be clear, we haven't gotten the official word, but thus far in the allocation process, Minnesota receives 1.69% from what is available across the country, and the federal government has said that there will be 1 million doses initially allocated. And just to be clear, that's where the 16,900 came from. And the pharmacies that were selected to be included in this program were Walmart and Thrifty White. They need to be national chains.
And Chris, correct me if I'm wrong, this is focusing, this will be at the state's direction, correct? So we can direct them
Yes.
who the eligible groups will be.
Yes, they will take our lead on this, and we've had conversations with Walmart, but we've had even more in-depth conversations with Thrifty White, and they are absolutely willing to be partners in, as you said, taking our lead where doses should be directed.
Thank you. Next slide. So just to address the desire of everyone to get more doses for people aged 65 or over, allocations this past week, at least 35,000 doses. It's not just at state-sponsored sites, have been distributed to providers across the state, going to local clinics, hospitals, other healthcare providers, with our goal to meet seniors where they are. Next slide. New pilot clinics for people aged 65 and over. We have 2 opening up, Duluth and Minneapolis, and we are working on a 3rd in southern Minnesota that we hope to be able to announce later this week or next week. And people over the age of 65 who have pre-registered for an appointment at previous clinics but have not gotten one will still be eligible, and we will still be using those pre-registration lists to reach out to people as appointments become available. So they remain on the list, and they will still be randomly selected to schedule an appointment at one of the community sites. And they will be notified by the method they chose if they have been selected to make an appointment. The previous sites that we had stood up will reopen again next week to begin their second doses, but not first doses. And we are working this path to be able to vaccinate Minnesotans in large scale as quickly and as efficiently as possible when we get more vaccine in the coming weeks and months. Next slide. And third, here's the provider map that I spoke of earlier on our website. So you can see the blue mark where there is vaccine available or being provided, where we're providing vaccine. So our goal here is that we will be able to connect eligible Minnesotans to their local public health department or their local healthcare provider in order to get a shot. And this site will grow out, and we will see more opportunities as more vaccine is allocated to us, and we're able to push that out to providers. So right now, more than 1,600 providers have registered with the Department of Health to administer the vaccine once more doses are made available to the state. And next slide. And that's it. Happy to answer questions.
Thank you, Ms. Kelly. And Ms. Erzman. Senator Ruud, you have a question.
I do on the second to the end slide. We talked about the people who had pre-registered and they could still, well, you don't have to find it. It's just that they pre-registered for an appointment and they're still eligible. What happened to all the lottery people? That's the most question, probably the most emails I get is, so we signed up for this lottery. We were told we didn't win the lottery. So where are we? Where are all those people that signed up? There was over 100,000 people, I believe, that signed up, and 8,000 people got the vaccine. But what happened to all those people, and where are they in the queue for getting the vaccine?
Thank you, Senator Rudd, Madam Chair. Very good question. If you think of the lottery as akin to everybody putting their name in a hat, and we had over 200,000 people put their name in a hat, and we were only able to select for vaccination last week, around 8,000. I'm not sure the exact number that actually ended up getting appointments last week. We can get back to you on that. Everybody's name is still in the hat, and we will continue to pull names out as appointments become available.
And so how do the people, have they been notified? Because there seems to be some confusion that they're still in the queue, or that they, I mean, they signed up and now they didn't get it. So, and you say that there still be appointments, but how do they know that?
So, Madam Chair and Senator, my understanding is that we have communicated with them that first, that they are in the queue, and second, whether they were selected to offer an appointment or not, and that third, that they are continuing to remain in the queue. And we will reach out to folks again as new sites open up to let them know.
So do they have any idea when that will be? I mean, next week or a month from now, or do they have, or should they be seeking their providers closer to home, and so that they get it? I mean, I don't, it's 200,000 people signed up and now they're kind of in limbo. So I think we need to figure out those 190,000 people. I think they need to have some security that they are going to get the vaccine, and that they are on some sort of, they're on some sort of list, but that's very unclear for them. So I would really like to see you address the lottery folks that don't know going forward what's going to happen to them.
Sure. I'm going to first bump it over to Chris Erzman. It sounds like she would like to answer this first, and then I'll follow up. Go ahead, Chris.
Yep, just a couple things. One is that, yes, messages were sent out to say that, we will continue to use this list to alert people to future vaccine opportunities, but then also want people to know that our healthcare systems are also sending messages out to their patients to say, we want you to know that we have a plan for vaccination, and, be patient. You're on the list. So I think that people will have, as we said, multiple opportunities to get vaccinated, not just through this lottery system. And so we're hoping that they recognize that their name is on this list and it hasn't gone away, and then that there will be other opportunities where they will be reached out to by healthcare.
Thank you.
Thank you, but I find that very confusing for seniors and very unsettling. So just a comment, and just anecdotally, I wanted to share with the committee that I have a very good friend who is a summer resident in my district, and she comes up to her cabin for the summer. And she is up here this week because she was notified by, she had a notification that said, hey, do you need a shot? You can have one, you're over 65. So she's here she drove from out of state, 3 states away, to come and get her vaccine this week at my local provider. So it's still chaos. Thank you.
Thank you, Senator Rude. I just want to do a quick update on Minnesota deaths and how it does affect those of our seniors. As of yesterday, and I want to thank Kevin Roche for doing these numbers for me. I don't have any fancy slides or anything, but we had 6,202 total deaths. 3,930 of them were in long-term care facilities. The best estimates that we have is that there's about 80,000 residents in those long-term care facilities. So the fatality rate for those in long-term care facilities was 4.9%. And for the rest of the population, the fatality rate is 0.04%. So the relative risk is 122 times greater for a long-term care resident. And so to be clear, for every one person who dies in the general population, 122 of them die in a long-term care setting. Yet we didn't make sure that those people got the vaccine first. And we're limiting what the rest of the population does when the risk of serious illness and death is basically non-existent. Yet you can get the same kind of spread when you look at age. 5,092 of the deaths that have occurred in those 70 or over, that population group has 706,000 members in Minnesota. So the fatality rate for those over the age of 70 is 0.72%. On the other hand, for people under 40, there have been 72 deaths, and there are 2.8 million in that group. So the fatality rate for those under 40 is 0.002%. So the relative risk is 360 times greater for those over the age of 70. And so when I see on this balancing population prevention of morbidity and mortality compared to preservation of societal function, I don't see the balance. I don't see the reason for the balance when there's such a huge greater risk for those over 65 risk of dying. And the governor's community program says that it's meeting seniors where they are. Like Senator Rude's point, you get somebody out of state going up to Breezy Point, being able to get their vaccination, and yet Minnesotans are driving across the state to one of these pilot sites if they were lucky to get into the lottery to get their vaccine. We need to be bringing this vaccine to the seniors. Thousands of shots for seniors are going to go through permanent sites in Duluth and Minneapolis, but not where they live. All of these seniors were just desperate and traveled miles to the 9 regional sites, but now they have to actually return to those same sites. I think we had in the press conference the other day, Todd talking about his mother. He drove from St. Paul to Pipestone to drive his mom another 40 minutes to Marshall. So he's going to have to do that same thing. That's not convenient. There are 250 community pharmacies around the state in these communities, small and large, and every county, every community has a local provider. And you say you have 16 providers ready to go. My senior's first plan would be to take all of these 80,000, 83,000 doses and activate all the 250 community pharmacies, plus other ones, and leverage these 1,600 providers to get to all of these communities. 16 weeks is a very, very long time for these seniors to be sitting in their homes another 4 months. That's way over a year. That's just after everything that they've been through and the risk that they have. And like some of them won't even go to drive to Marshall or to Duluth or to Minneapolis because they're so afraid. Today, one of the lucky pharmacy providers that happens to be on the state provider list, she's literally going to 4 individual homes where seniors are aging gracefully. They are, again, afraid to leave their home. One is in a wheelchair, one is 94 living alone, and the other 2 are also elderly. The 94-year-old is so desperate to get the shot so she can go back to church. So I'm begging and pleading to just flip the mindset. Every dose that comes in, the 1.69% of the million doses that we could be getting, more than 35%, 35,000 have to be going to the seniors. We need all of them to be going to the seniors, and then we can work on preservation of societal function. So that's my soapbox today. I really still believe seniors need to be first. So I will go to more questions. Oh, go ahead, Ms. Erzman. Thank you.
Senator Housley, I just wanted to clarify that we did prioritize. So I just want to clarify what you're questioning, because we did prioritize our skilled nursing facilities, our assisted living, and those seniors absolutely very first. We did include healthcare workers, and that includes the people that care for them, but that was the priority for the first doses of vaccine. So I wanted to make sure that we didn't have a miscommunication on that, just to acknowledge that we do recognize who is at the greatest risk, and did put doses there. And then I think I want to just acknowledge that I agree with you that the 16 weeks is a long time, but it's limited at this point by the number of doses that we have available. And so I want to acknowledge that. And I do understand the frustration. My dad is 88 and is in Florida right now, and I talk to him every night, and he tells me about his experiences of trying to get a vaccine there, and it's I would say it mirrors or echoes kind of what we're hearing. The one thing that I do want to make sure that we acknowledge is that we do want to make sure that our most vulnerable are being vaccinated, and that is a priority. But one thing that I did mention on the media call yesterday, and I think it's worth restating, is just that every person who gets vaccinated in Minnesota benefits all of us. And so by having our healthcare vaccinated, that's important, because we have people to care for these seniors. We have the healthcare system that they need. But every time someone gets vaccinated, even if it happens not to be me, that means that there are more people protected, and that the chance of transmission in our state goes down a bit. So just want to acknowledge that too. And I will stop because there's so many questions, but I wanted to make sure that you were clear on the vulnerable adults being first in phase 1A.
Thank you, Ms. Erzman. And I know that the skilled nursing facilities, the nursing homes were first because they were under the federal plan. And I have heard from the facilities that last week was when they finally got partnered up with local pharmacies, and that has been going relatively smoothly. So I want to thank you that our long-term care facilities are now 6 weeks in, finally everything is going smooth. But also remember that of the 89% of those that have died, 65 and older, 89% of our deaths have been that age group. 63% of those have been in long-term care facilities, but 26% of those are still out in the community. And remember that their fatality rate is 0.72% compared to the general population, which is 2/1000ths of a percent. So again, I still strongly beg that we can get that population vaccinated first, so they can get back to church, get out of their homes, and then bring the vaccine to them instead of driving all over the place. There should be a local pharmacy within a mile or two from their place to be able to get it. Senator Putnam and then Senator Eakin.
Thank you, Madam Chair. Madam Chair, may I ask 2 questions if one of them's easy?
Yes, go ahead. You can have 2.
All right, thanks. The first one is, both of these are basically clarifications, because frankly, I'm still struggling to understand, like I think a lot of us, I'm still kind of struggling to understand all the data. and what it means. And so the first question, I'm not sure who to address either of them to, is if someone's a 65-year-old nurse, where do they show up in the data? Do they show up as part of the information that says about healthcare professionals, or do they show up in terms of seniors, or do they show up in both? The second question has to do, again, with accountability. I'm still unsure who's responsible for what. So the federal pharmacy program that's attached to Walgreens and Thrifty, do we have the option to opt out of that? Is that completely independent from the state, or is it something the state opted into and we're still supposed to administer it? Or I'm just trying to suss out responsibility in terms of state, federal, local, and then the providers themselves. So those are my two questions, Madam Chair.
Very good. Ms. Earsman.
Madam Chair and Senator Putnam, just a couple things. First of all, for a nurse that's 65 plus, when you see on the dashboard, they are being counted in the 65 and older category on the dashboard. They would have received their vaccine as being part of phase 1A as a healthcare worker. So, you know, in a sense, if we have healthcare workers that are over age 65, we kind of were able to kill two birds with one stone, if you will, that we got them vaccinated as a healthcare worker, but their age also made them, you know, eligible. So they would be counted in the 65 plus data. And then for the PPP program, that was a federal program that the feds put together, and it went out to all of our skilled nursing and assisted living facilities. They had the choice to opt in or to opt out. When we learned in early December that our elders, originally for phase 1A, it was only going to be healthcare workers. And when we learned that our elders were going to be included, we actually did some outreach to our facilities to see if any of them wanted to opt out. And the reason I say that is because with so many facilities concentrated on a limited number of providers, we were hoping to diversify the provider population so that we could get more facilities vaccinated more quickly. And we were able to do that. And so we had about 89 facilities that we were able to match with a pharmacy partner within the skilled nursing group. Within the assisted living group, we had matched about 800 with local pharmacies, and they have been vaccinating. And long before just last week, I do want to clarify that that has been going on. It's just that they had to finish skilled nursing before they moved on to assisted living. But we matched about 800 facilities with a local provider, and about 800 were matched with the PPP program providers, that's CVS, Thrifty White, and Walgreens. And the challenge with that program, originally the federal government had indicated that they needed to be able to complete their first dose vaccination within 3 to 4 weeks. But the breadth of the program and the number of facilities meant that it has taken these partners longer. But that was the original expectation of the federal program. And that is a program that, as I said, is being run by the federal government. We are working with them and seeing what we can do to try and assist. But it is a federal program.
Thank you, Ms. Earsman. Okay, Senator Putnam, you're good. Senator Aiken.
Thank you, Madam Chair. And I have a couple of questions as well. And I was intrigued by what you had said as far as on the second visit, that there were 20% more that came back for first dose at that point. And that's encouraging. I guess I wanted to clarify though, if that's 20% of the total, or if that's 20% of those that were left still that hadn't done the first dose. But it seems to me that one of the reasons that you may have many coming back that didn't take it the first time around is they saw that the side effects were relatively mild, maybe, that it wasn't what they were, they maybe had concerns or were holding back. And I know you're saying that there's going to be a third visit where there'll be another opportunity, which I think is good. And hopefully, you know, there's a similar type of response. And so I was wondering, I guess, you know, as far as if you could talk about the response, the basis of that response, if it's because of milder side effects. I haven't heard of any serious side effects of any kind. If you could maybe speak to that. And then also, I was wondering, as far as the second vaccine, if there's any, have there been any problems at all at getting the second vaccine out in the second dose in a timely manner, so that it meets the time frame? Because as I understand it, it's 3 to 4 weeks, depending on whether it's Moderna or Pfizer that's being administered. And if there's any problems that are anticipated, because if, and maybe you could talk about the effects if it doesn't meet that time frame.
Ms. Ersman?
Chair Housley and Senator Aiken. So the 20% was what we heard from the federal government looking overall at the program. So what they were seeing across all the states, that they were seeing that, yes, there were about 20% of people who had not chosen to be vaccinated the first time were coming back and interested the second time. And I agree with you. I think that the reason for this is that there was some trepidation about being kind of first in line, and they kind of wanted to see, how did it go? Was it okay? And so now that they've seen that, they are more comfortable accepting vaccination. In terms of the second vaccines, those vaccines are allocated to us on a separate track. So when Deputy Commissioner Kelly said that, we get our allotments on Tuesday, and, we're placing orders Thursday, Friday, and doses are shipped then the next Sunday night and so they're coming Monday, Tuesday, Wednesday, Thursday across the week. For the second doses, that's a separate allotment that the federal government gives us, and those doses are allotted and shipped separately. So in other words, for the pharmacies that Senator Housley was mentioning, when they get their doses this week, they don't have to worry about the second doses. We ship them to them in a timely manner, and they come in a separate allotment. So that is taken care of. So at this point, we're not anticipating problems with that. I think after a year in the pandemic, I will say never, but at least the way that the allotments have gone thus far, that there should not be a problem with that.
Thank you, Senator Aiken. I know we need more doses in order to get everybody vaccinated, but it's not a matter of just getting more doses. It's how we distribute those doses. That's what I'm trying to get that point across. Can you give me the specific breakdown of this 83,000 doses that we're going to be getting this week? How many are going to seniors? How many are going to teachers? How many are going to state employees? Are seniors only going to get 35,000 of these 83,000? How is it going to be split up?
Madam Chair, we're working on that now.
Thank you, Assistant Commissioner Kelly. Can you get that to me as soon as you have it? Because I think that's what people are really wondering, how are those being allocated, and what priority are seniors really given when the headline is 35,000 more going to seniors 65 and plus. Again, 1 million seniors in the state, that's going to take a long time. So if we have 83,000 coming in, and they're at the highest at risk for losing their lives to COVID-19, I think all 83,000 should be going to those seniors. Another question I have, is there any oversight or direction given to those that are getting the vaccine? Like, I know Duluth Essentia Health is giving the vaccine to those 65 and older, yet the Mayo Clinic says you can't come in to start getting the vaccine unless you're 80 and older. Is it all at the discretion of whoever gets it?
Chairwoman Housley, yes, I mean, we're trying to balance opportunities for everyone 65 plus, but recognize, as you pointed out earlier, that populations that are older. So we have a separate program to deal with individuals who are living in congregate care settings. And we acknowledge, I think we're all in agreement that they are at the very highest risk, and they are all in programs to get vaccinated, so they have that opportunity. But then when we get to the population that's living in their homes, we know that the vast majority of deaths are occurring in people 75 and older. And so as health systems are allocating vaccine, they are trying to work on how they can best reach the highest risk populations. And so what we've said is that for health systems that are allocating based on risk, that is within the spirit of our Immunize for Impact. But we also recognize that if some systems are choosing to vaccinate 65 and older, that is certainly within our current recommendations. So we are allowing for some discretion within the systems, but for those systems that have said we're starting with our eldest population, that absolutely fits with the epidemiology that we've seen and with our commitment to Immunize for Impact. So I would say it's a both and, but for those that are doing that, it is consistent with the spirit of our guidance.
Thank you. I have just another quick question. Ms. Kelly, hopefully you can get me that dissemination of the vaccine ratio over to us, because I know in the last meeting, the department said they were going to get me the info on why the department was collecting the data in the lottery website questionnaire when they were asking, if you were Native American, what tribe did you belong to, or if you were a renter or a homeowner. I asked where that data, why it was being collected and where it was going. And also what was the process for hiring the vendor that was collecting all of this data. I didn't get any of that information yet, so I'm still waiting. But I am getting a ton of questions from our long-term care facilities. What is the plan to reopen them, to get it back to normal? If you get 90% of those in long-term care residents vaccinated and 50% of the healthcare workers, like what's the benchmark that they can open up? Because that's the end goal. They want to have people come and visit them. Do we have a plan yet for opening our long-term care facilities?
Chairwoman Housley, yes, I think there are a couple of factors. The guidance that we're working under was put out by CMS, and so that does have an impact. I think what you'll see, and certainly we want to make sure that our community transmission is down, as we acknowledge when community transmission is high, that impacts our seniors no matter what we do. But we're looking to see what the CMS guidance is, but the information that we're seeing with our case numbers dropping, as well as with numbers in the facility dropping because of vaccination, that means that even with the current guidance for visitation, that more and more facilities will be able to have, visitors and in and out, because the numbers within their counties will be down. There won't be any cases in their facility. We're moving toward a much better place, but we also do have to look to CMS for some of that guidance as well, and anticipate that as they see the impact of vaccination on these populations, that they will be providing that, because not every state has done it like Minnesota, in which they're most vulnerable in long-term care receive vaccine, but most have, and so they will have that information. One thing just to remember is that right now we do not have information on whether someone who's vaccinated could still acquire asymptomatic disease and be a risk of transmission. And so that's something that is being monitored at the federal level. The reason that I say that is because the clinical trials that were done had the endpoint of clinical disease. And so likely the biology is similar. We simply just don't have that data. So all of those factors weigh into the decision-making that I think CMS will make, but the guidance that we have in place means that with fewer cases in the community and no cases in the long-term care settings, that visitation is much more of an option for many, many more facilities. And as you acknowledge, it hasn't been that way for a number of months because of the high case transmission.
Thank you, Ms. Eiersman. That is all the questions for me right now. Again, begging you to prioritize our seniors 65 and older, make it convenient, seniors first. I don't know, Susie, if you can bring that slide up, just with it does, we have it on the website, or we have it on the seniors first. And down here, it's these are the 9 pilot sites, which are now 2, possibly 3. I want to get the vaccines to everybody, to where they live. So thank you, members. No other questions? All right. Thank you, Ms. Ersman and Ms. Kelly, for presenting today this morning. Thank you.
Thank you.
Thank you.
All right, so members, we now have Senator Carlin Nelson and Senate File 178. Want to make it known for the record that we do have a quorum. So Senator Nelson, and I think Senator Nelson, this bill is going to be going to HHS after this committee. So we're not laying it over, it's going to go on to HHS. So go ahead, Senator Nelson.
Well, thank you, Madam Chair. Thank you so much for hearing Senate File 178, and thank you for incorporating that. Has the author's amendment been incorporated? The A2 amendment, do members have that? It is an author's amendment, yep. Madam Chair, and if that could be incorporated with the bill as it's moved, that would be wonderful. Thank you.
Senator Rude moves the A2. Oh, this is your first stop, isn't it, Senator Nelson?
Yes, it is, Madam Chair.
Go ahead.
Thank you. And first, I'd like to thank my co-sponsors, Senators Eakin, Senator Klein, Senator Torres Ray, and Senator Duckworth. Senate File 178 addresses the public health emergency tsunami that many of us right here in this committee and throughout the legislature and far too many Minnesotans have experienced with loved ones and family members, that Alzheimer's tsunami. I'll give you just a basic rundown of the bill, then I have a few testifiers and some closing comments, Madam Chair. Senate File 178 provides $250,000 to the Minnesota Department of Health to develop a focused public awareness campaign with culturally specific messages, of course, about awareness of Alzheimer's disease and other dementias, the importance of early detection and diagnosis, and the importance of discussing cognition with their health providers. The campaign will obviously promote the benefits of early detection and the importance of visiting with your healthcare provider about any cognition concerns or issues. It also will outline early warning signs of cognitive impairment and the difference between cognition, regular cognition issues regarding aging and dementia. And it will provide a general awareness of the Alzheimer's disease. As I said, messages will be targeted to the general public and as well designed to reach underserved communities, including but not limited to rural populations, Native, Indigenous communities, and communities of color. And it allows the Minnesota Department of Health to contact with third parties to implement the Alzheimer's public awareness campaign. Obviously, that would need to be through competitive bidding with an entity that has experience working with people who are experiencing dementia, requires a report. And that is, and just for some of you who were here in 2000, I believe it was 2014, or 15, we passed the Alzheimer's Research and Support Act, and all of that was put into place except for this little piece about the public awareness. And of course, these resources will need to be online as well. And so with that, Madam Chair, if I could bring up my testifiers, if there are no questions, and then I'll have a few comments and closing comments at the end.
Okay, Senator Nelson, thank you so much. And members, I'm going to move that A2 amendment. No, Senator Abler moves the A2 amendment. Everybody unmute. All those in favor, put your thumbs up and unmute and say aye. All those in favor say aye.
Aye.
Those opposed, nay. All right, the amendment is adopted. Now we just have your testifiers just coming on right now, Senator Nelson. I think the first one is Josh Ney from the Alzheimer's Association is Josh. There's Josh. Hi, Josh. Go ahead, Mr. Nay.
Thank you, Madam Chair. And Madam Chair, members of the committee, my name is Josh Nye, and I'm the Manager of State Affairs at the Alzheimer's Association. Thank you for the opportunity to speak with you today about our support for SF 178. And thank you, Senator Nelson, for introducing this bill. As you may have seen on Monday, legendary singer Tony Bennett shared his Alzheimer's journey with the world in an AARP article written by Mr. John Colapinto. In his article, Mr. Colapinto wrote, "Alzheimer's carries a stigma, since people feel a special terror of an incurable disease that ruthlessly detaches its sufferers from the places, events, and people that anchored them in life. Many treat it as an immediate death sentence and retreat from the world, encouraged to do so by family members who fear the disease and its unpredictable and sometimes socially embarrassing course. The stigma and fear is, in part, why public awareness of Alzheimer's disease is so important. 99,000 Minnesotans live with Alzheimer's disease, and we estimate that number will increase to 120,000 by the year 2025. 2/3 of those living with Alzheimer's are women. Black or African Americans are twice as likely, and Hispanic or Latinx Americans are 1.5 times more likely to develop Alzheimer's than older whites. Quality care for people with Alzheimer's disease and other dementias starts with an early, documented, and disclosed diagnosis. However, only about half of those with Alzheimer's have actually been diagnosed. And among those seniors who have been diagnosed with Alzheimer's, only 33% are even aware that they have the disease. Early detection and a formal diagnosis allows people living with dementia to have access to available interventions, build a care team, participate in support services, and potentially enroll in clinical trials. 95% of those with dementia have other chronic conditions, including diabetes and hypertension. And a diagnosis that includes care planning for these conditions saves people with dementia and their caregivers from having to travel and pay for unnecessary hospital visits or trips to the emergency room. Alzheimer's is the most expensive disease in America. The average annual per person Medicaid cost for someone without dementia is $374 versus $8,779 for someone with dementia. That means a person with dementia costs Medicaid 23 times more than a person without dementia. In 2020, Minnesota, through medical assistance, spent $905 million on supporting those with dementia, and that cost is expected to increase by 20% in the next 4 years. But the Alzheimer's Association ran a fiscal model that shows we could reduce lifetime per person health and long-term care costs by as much as 15% or $64,000 by diagnosing Alzheimer's earlier. Primary and long-term care costs are lower in people with diagnosed and managed mild cognitive impairment or dementia. Over the past half-century, public health has provided leadership on the needs for diagnosis disclosure with other difficult conditions. Through public health education efforts and advocacy, healthcare providers are much more open and honest discussing difficult diagnoses like cancer or HIV/AIDS, and relaying the impact of their diagnosis with care and understanding. We are seeking the same with Alzheimer's disease. Minnesotans must feel comfortable discussing symptoms and concerns with their healthcare provider. This requires addressing barriers, including low public awareness of the early warning signs of dementia, as well as the emotional distress and misconceptions about the disease. By making this investment to promote early detection and diagnosis, we can show Minnesotans that living with dementia can mean a more actively engaged life, a higher quality of life, and significantly reduce costs for health and social care. We ask the committee to pass SF 178 as amended. Thank you for your time.
Thank you, Mr. Nay. Oh, that's weird. Thank you, Mr. Nay. The next testifier, Senator Nelson, is Mary Margaret Lehman from Caregivers and Alzheimer's. Oh, you're a caregiver and Alzheimer's advocate, Mary Margaret Lehman. Go ahead. I think you need to unmute. Mary Margaret, you're
Unmute.
there. You go. There you go, Mary Margaret Lehman. Go ahead.
Can you see me now also?
Cannot see you, but we can hear you.
All right. Well, seeing is not necessary, but there is that.
Now we see you, Mary Margaret.
Okay. figure out a little bit on Zoom. Madam Chair, good morning, and thank you so much for the opportunity to speak with you today. It took 15 years to get a diagnosis of Alzheimer's for my husband, Ken. He was seen by 9 doctors, 2 internists, 2 geriatricians, 4 neurologists, and 1 neuropsychologist. One geriatrician fleetingly suggested Alzheimer's, told us to check back in a year. It could be Alzheimer's, but I thought, wait, Ken doesn't have any memory problems. My father had Alzheimer's. My uncle had Alzheimer's. Ken's father had Alzheimer's. They all had memory issues. Weren't memory issues the hallmark of Alzheimer's? Ken did not have them. I began to notice changes in Ken in 1995 when he was 58. We were living in California where we had both grown up. Ken began to withdraw from family and friends and social gatherings and his favorite activities. He had difficulty navigating familiar destinations. His problem solving, judgment, and reasoning, particularly in regard to our personal finances, especially paying bills and taxes, were an issue. Ultimately, more financial missteps resulted in our bankruptcy and losing our home. We moved to Minneapolis and lived with our daughter and family for 6 months. A friend from California called to suggest that we call the Minnesota North Dakota Alzheimer's Association. We learned that there are 10 signs of Alzheimer's, and problem solving, reasoning, and judgment are definitely signs. We were able to find a wonderful team of doctors who, after thorough neuropsychological testing, diagnosed Ken with Alzheimer's disease. Through his doctors and the Alzheimer's Association, Ken was able to learn healthy living habits, to live with strategies to abate the disease. The doctor was amazed at how well Ken responded. And since then, Ken has become an advocate himself, a mentor, a speaker, and an educator of Alzheimer's, providing awareness of Alzheimer's and promoting the benefits of early detection of Alzheimer's. Ken says that being able to reach out and help someone else advocate and educate gives him a sense of worthiness, that he still has something to contribute, and that he is still a viable person. My love and I have found that there is life after a diagnosis of Alzheimer's, but we need your help. The 99% of Minnesota now living with Alzheimer's need your help. The 120 persons projected to have Alzheimer's in 2025, just 4 years away, need your help to live with Alzheimer's. The Minnesota North Dakota Alzheimer's Association needs your help to help us educate and have a campaign to make sure that those with Alzheimer's get the care and support they need so that they can come out from behind closed doors, pulled shades, and they too can feel valuable and feeling they are contributing to their communities. Thank you.
Thank you, Mary Margaret Lehman, for that story. And I hope Ken is doing well.
He is. Thank you.
Good. Thank you. Next up, Senator Nelson, you have an Alzheimer's advocate, Lindsay Hilmer. Lindsay, if you can unmute yourself. Hi, Lindsay.
Hello. Good morning.
Good morning.
I'm coming to you from Alexandria, Minnesota, and I'm going to share the story of my grandmother, Betty.
Go ahead.
Betty was born in 1931 in Iowa. By 1960, she had a family and was living in Henning, Minnesota. 1978, she retired from a hotel business that she shared with my grandfather, but by 1984, she was widowed. So from 1984 on, we just assumed my grandmother was just a very busy woman. She held jobs. She was busy in her community. She was helping raise grandkids up in the Brainerd area. It wasn't until 1997, after many times that she would forget to check in or forget a birthday here and there. We thought this was the normal aging process. She was just a busy woman, fiercely independent. My family took a trip to California in 1997 with my grandma, and all day long she would ask, where are we going? What are we doing? I was 13 at the time, so I just assumed that grandma just doesn't listen. Maybe, just a new environment, lots of things going on. I just wasn't worried about it. In the year 2000, she decided to downsize and move closer to my family to Carlis, Minnesota. Because it's such a small community, we knew everyone there and thought there'd be plenty of people to help keep an eye on her and keep her busy. What we didn't realize, though, is what she had was called sundowners. So at night, she would become very active. Her mind would travel to a different time. The neighbors would all see this, and they'd also see that she'd be calling the cops, thinking that she had people in her home. The people of the community mostly only knew someone years ago known as senile, but nobody really knew how to help her. All they knew is that they could only tell us the stories. It was until 2004 where we failed to get her driver's license taken away after car accidents, and after too many calls to the sheriffs for her thoughts of home invasion, which was just herself creating a mess and not remembering what she did, that we had put her into a care facility that was alarmed but not locked. My grandma, being the athletic person that she was, decided to scale an 8-foot chain link fence one night and get a mile down the road before the care facility found her. After the second escape, where she hopped a fence and made it 2.5 miles to a gas station, they told us that she was too much of a flight risk and that they couldn't help her. The ALEC community just did not have enough beds or enough care facilities at the time to handle someone in my grandma's state. So we did find one in Glenwood, Minnesota, half hour south of us, where she was locked in and had the best care and the best dignity shown to all stages of her Alzheimer's. It was in 2016 that she finally passed because of the disease. I share this story because I was robbed of 20 plus years of my grandmother. To be able to share the same loves of gardening and painting and antiquing, and to also see a role reversal. I had to learn patience and understanding and empathy when my grandmother would tell me stories of, she'd be crying because she'd tell me she had failed a test. And she would also show me the tricks that her stuffed animals that she believed to be alive could do. I had to believe for her to keep her calm. I was like, these things could have been very different for my grandmother's story. The parts that were hurtful, the parts that caused us anguish and concern, and the parts that caused the community for fear of her safety. The fact that we just didn't know what we were facing. We weren't prepared for any of this.
Thank you, Ms. Thank you very much for your story too, and I'm sorry you lost your grandmother to Alzheimer's. As Senator Nelson knows, my mother too. Your stories are all so familiar, and I go back and forth between, oh my gosh, should I really listen and bring all that back up again, or should I just go, oh, I know, been through it. Yeah, so many of us, and Senator Nelson too. So thank you for your testimony. Members, we also have a letter in your packet from Volunteers of America supporting Senator Nelson's bill. I think it's a fabulous bill, Senator Nelson. I wish you luck with it going forward. Members, are there any questions? All right, no further testifiers. Hearing none. Oh, Senator Eakin.
Thank you, Madam Chair. And I just wanted to speak up in favor of this bill and thank Senator Nelson for bringing it forward. This is such an important issue. And, there's a lot of talk about the pandemic now, obviously, justifiably because of how horrendous this pandemic with COVID-19 has been. But there is another epidemic that we're facing in this country, and it's a quieter epidemic with Alzheimer's and other forms of dementia. And it touches so many people's lives personally. It goes well beyond the individual who's directly impacted to their families, and as his testimony provided shows, to their communities, and to the cost to society generally. So this is something that we really need to focus attention on. There isn't enough public awareness there. In talking about people being personally affected, my own father went through it, so I share that experience with you, Chair Housley and Senator Nelson, and so many others, I'm sure, in the Senate and throughout the state who have gone through similar experiences. So I just want to, again, voice my strong support for this. Thanks, Senator Nelson, for bringing this forward. We need public awareness, and we need to detect these things earlier. We need to remove the stigma, as Mr. Ney was saying, that's associated with this. We can't deal with it effectively if we don't acknowledge it, we don't prepare for it, and we don't address it. So thanks again.
Thank you, Senator Aiken. Seeing no other testifiers, Senator Nelson, would you like to wrap up your bill? Final comments?
Yes, thank you, Madam Chair. And Madam Chair, Senator Aiken, thank you for sharing your comments today as well. And I know that we have traveled these paths with our loved ones, as have so many, and I'm sure that your eyes are watering as well as we hear about the journey of so many of Mary Margaret's husband, for example. And the point is, there are things we can do. And I just close briefly. I appreciate the strong comments and support from this committee, and certainly don't want to get in the way of that great support. But I just would be remiss if I did not mention, we must get to this point of total public awareness and early diagnosis. That is essential in how we can help people with Alzheimer's and their families plan better, live better, and have better outcomes. And we salute our innovators and our researchers and our scientists that are working 24/7 every day. There's work on Alzheimer's treatments, cures, and prevention. Now, the thing we can do in the legislature is make sure that our public health is robust in making sure every Minnesotan knows about the importance of early diagnosis, and that spending that time with their physician, their family providers, and then preparing and letting people with Alzheimer's make decisions as they can early on in this disease. It's really shameful to not get that diagnosis until the person might not have the ability to participate in some of those decisions that are so important. So with that, Madam Chair, members, I thank you for your time today. I thank Mary Margaret for sharing your story, which is so compelling, because you're not alone. There are so many who are walking this path, and we have the ability to make that path easier, get those treatments, therapies, diagnosis, those wonderful habits, those programs that help families and their Alzheimer's loved ones live better lives. So thank you, Madam Chair. Really appreciate the opportunity to bring this before your committee.
Thank you, Senator Nelson, and we thank you too. Members, we're going to move this bill as amended. So if you want to turn your cameras on and unmute yourself. And as long as there's no further discussion, Senator Curran moves Senate File 178 as amended.
So moved.
Be recommended to pass and referred to the Committee on Health and Human Services, Finance and Policy. All those in favor say aye.
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 Those opposed, no. The motion prevails. There you go.
Thank you, Madam Chair.
You're on your
Thank you.
I am hoping next week, members, we can have MDH come back again to get some of those questions that we had answered and get more specific numbers on how many more vaccines are coming, where they're going, how they're being allocated, how successful they are, how are they getting them to the seniors in our communities. I'm thinking that's what our plan is going to be for next week. So until then, I will let you know, but this meeting is adjourned. Thanks for coming.